How to lower cortisol in PCOS? This is a question which many PCOS women face with in their PCOS reversal journey. So in this video, I'm going to cover what is cortisol, how high cortisol impacts PCOS, how cortisol actually rises in your body, and how to lower it at 3 different levels. Hi, I'm Dr. Rashmi Pawar. I am an OBGYN doctor who's turned into a life coach specifically to help PCOS women change their mindset before they change their lifestyle so that they don't suffer with complications due to PCOS. Now, let's begin with what is cortisol. Cortisol is nothing but a stress hormone which is made by adrenal glands. These are glands, tiny glands, which are sitting on top of our kidneys. These glands specifically release cortisol, and this cortisol plays an important role in our metabolism, in immune responses, and our stress management. This cortisol should rise in spikes depending on the situation. But continuously high levels of cortisol in PCOS can have a negative impact on our well-being. Now, PCOS. What is PCOS? PCOS is basically a condition due to insulin resistance. This can be either inherited, as in your parents gave it to you through their genes, if they have diabetes, obesity, hypertension, or you have acquired PCOS or acquired insulin resistance because of consuming highly refined carbohydrate-rich food, which increases the insulin and eventually has produced insulin resistance in your body. Or if you're constantly stressed emotionally, like the thinking patterns that we have are generating this constant stress response in your body, which is constantly keeping your cortisol high. In PCOS, we barely make monthly egg. This is because, insulin resistance is preventing ovulation. The brain is thinking that it's not safe for you to have a baby, so it's stopping ovulation. So when you're not ovulating every month, what's happening is it's messing up with our natural hormones. Like the hormones which are supposed to rise and drop and rise and drop, that's not happening in PCOS women. And along with this, if you have thought patterns which are like keeping you spinning in stress cycles, that's like adding fuel to fire. Now, chronic emotional stress is something which can increase cortisol, which directly worsens insulin resistance. And cortisol is therefore called a stress hormone. So chronic emotional stress is one of the biggest components of causes of rising stress hormone. Apart from that, sleep deprivation is another reason why your stress hormone can be high. Like if you're not sleeping properly, you're sleeping late, or you're sleeping just not well, right? You're lying down, but you constantly keep waking up. That in itself can increase your stress hormones. Apart from that, if you're consuming a lot of caffeine during your day in the form of coffee or tea or chocolates, this caffeine can stay in your blood for almost 6 to 10 hours. Like the half-life of caffeine is almost 6 hours, 5 to 6 hours, and quarter life is almost 10 hours. So if you had your last cup of coffee, say at around 6 p.m., you are going to have half of that caffeine still in your blood by 12 midnight, and you're going to have 1/4 of that caffeine in your blood till 6 a.m. next morning. So that caffeine can keep you awake, not let you sleep properly, and can increase your cortisol. Apart from that, alcohol also can lead to a very disturbed sleep, as a result of which you can have increased cortisol. I have an episode on caffeine which you can check out in this podcast series. I will add it in the show notes, a link to it. In this episode, I'm going to talk about how can we reduce your chronic emotional stress so that you can reduce your cortisol, which is directly worsening your insulin resistance. So cortisol rises when we don't cope with our emotional stressors in a healthy way. Our body shows us signs of chronic stress, like we are constantly worrying, we are constantly irritated, depressed, have mood swings, we are unable to sleep at night, or we are having unexplained headaches, loose motions, chronic fatigue, or neck pains. Now, because these things are happening in your body, we go to habits that give us quick relief. Now, mind you, these are not like something which need treatment, right? So you might not go to a doctor for worrying or irritation or depression or mood swing. Depression, yes, but just feeling low, you might not go. Not able to sleep at night, so many patients don't go to the doctors. They try to fix it by themselves. You might reach doctors when you are having unexplained headaches, loose motions, chronic fatigue, or neck pains, and the doctor would tell you things like, okay, it's the stress. There's nothing we can do about it, right? So when the doctor has sort of refused to help you in that area, we go to habits which are like quick reliefs, which help us feel better instantly. We go to emotional eating when we are not hungry, or we'll end up overeating foods that are not healthy, or we are constantly snacking, because that emotional stressor is there, and every time you eat something, you'll feel better. Apart from that, you might go to coffee or caffeine-based foods like chocolates or tea to pick us up as we are so exhausted because of the sleep deprivation, or just like tired of feeling so negative all the time, because any sort of negative emotion, worry, depression, anxiety, feels very heavy in your body. So it's like you have done a lot of heavy lifting, you really feel so heavy. So we go to caffeine, and then caffeine, as I said earlier, will worsen the stress hormone again. Apart from that, you might go to substances like cigarettes, alcohol, vaping, or weed. If that's not it, you might go to things like scrolling on your phone, or impulsive shopping, or pornography, or gambling, or constantly gaming. But all of the above are not really solving your emotional stress. It's just sort of like using it as a band-aid. But the wound is like infected badly, so that band-aid is not going to help much. Now, how do we solve it, right? So emotional stressors can be solved at 3 levels. One is by regulating yourself when in the emotion with somatic exercises. So when you see yourself as irritated or constantly worrying, you need to interrupt that sort of pattern with some somatic exercises like breathing exercises, box breathing specifically. I have an episode on box breathing, or like breathe your way to reverse PCOS. That's what it's called. I'll reference that. Then walking barefoot, especially if you are used to wearing slippers at home or at work, like just walking for some time barefoot can help. Putting ice on your hand, walking out in the heat, especially if you're in air conditioning, or if you are like in a nice cozy place, go inside, outside in the cold area, like changing the temperature, meditating or humming, because what happens is like there are some thoughts which are like spinning you in worrying and irritation and doubt and confusion and overwhelm. So we want to change the focus of your brain to something which is not so harmful, like these exercises I talked about. Now the second level of dealing with your emotional stress is by understanding your stress. Like, why are you stressed, right? Sometimes our mind is guiding us to something that we want, and we are not having it right now. So find out if you can get what you want, right? Example, you're stressed about, you didn't do something which you wanted to do. You're procrastinating and you're just worrying about it, but you're not doing it. So the reason why you're worrying is because you want to get it done, right? So like, can we just get it done as early as possible? Because that can actually help you not feel stressed, because once that task is done, you don't have to worry about it, right? Like, it's done. So like, the reason why you're stressed is probably because you're procrastinating, and you shouldn't be procrastinating. You don't want to procrastinate, you just want to finish it off. So find out what is the stress about. Now sometimes the stress is coming from something that doesn't even make sense, and we want to find that out as well, so we can reason with our mind. Like sometimes we can keep thinking things like, I can't do it, I can't do it, I can't do it. We're just spinning in that thought. even when we have done that thing like 80 times in the past. So that's just like a thought error that our brain is offering, which doesn't make sense. Like, why do I keep saying it? And we do it out of habit, and we need to interrupt it. So understand, what is your stressor about? Why is it coming? Is it coming from a legit obstacle that you're facing, or is it coming from like a thought error? Now, I help my clients understand their stress in coaching, but you can try to do this on your own by just writing down your thoughts on paper. Find out if your stress is guiding you to something or keeping you in a loop. If you can't do this on your own, please consider applying for my coaching program. Now, the third way of interrupting emotional stressor is deciding to practice mindfulness and relaxing activities regularly before stress takes over. Now, do this on a regular basis. Daily journaling practice, practicing gratitude and appreciation every day, once every day, because these habits, these sentences that you're appreciating will generate a very positive emotion in your body, and that's the antidote of stress. So daily journaling practice, specifically in the morning, if you can make time for it, right? Like if you are someone who has rushed mornings, please wake up a little bit early. And if you can't wake up early, go to bed early. So these are the things that I help my clients with during our sessions, right? Like small ways to micromanage your life, your specific life, so that you can get to a place where you have all these amazing habits which you can count on no matter what. So daily journaling practice, preferably in the morning, practicing gratitude and appreciation at least once a day or at night. Daily 10 to 20 minute house exercise, like an exercise that you can do at home, walking barefoot, again intentionally on grass or rough surface for a few minutes. You can do this when you are in the emotion, or you can do it intentionally to tell your body that, listen, I'm taking care of you. This is how I take care of you, because I'm enjoying this experience of walking on grass or a rough surface, like, when those small pebbles are there, you just walk on barefoot, so that you're sort of like becoming mindful of that activity. Drinking around 500 ml of water intentionally, especially if you have PCOS and you want to lose weight, I would go for a liter in the morning, because you've been thirsty all night, you didn't drink water. Perfect time to drink water, and enjoy the sensation of water going down your body. Meditation can be another way. Enjoying a drive, like if you have to go pick up someone, or you have to drop someone, or you have to reach work, instead of looking at it as I don't want to do this, like, am I a driver or something, I wish I had a driver and all. Instead of that, like, oh no, this is actually a fun experience where I get to glide so fast, right? Like enjoying the sensation of driving, listening to a song, praying to God, petting your fur baby. So all these sensory experiences you can do intentionally to ensure that your stress is under control. Now, I do these, most of them, every day. Doing this every day is a constant reminder that I am taking care of this body. Doing it regularly is also a reminder that everything can go upside down in my life, but these things would happen no matter what, as they calm me down and they bring me joy. That's how we interrupt the stress trap, by using the highest part of your conscious brain to direct the subconscious brain. Now, understand, this cortisol is not as high as a medical condition like Cushing syndrome, where the patient has this moon face. That syndrome needs aggressive treatment or even surgery, depending on why that person is getting such high level of steroid hormone, right? That syndrome is not PCOS. And you don't need to worry about your cortisol being that high. It's not as high as in Cushing syndrome. Cortisol rise in PCOS can be easily dealt with above strategies, apart from reducing your caffeine intake before 3 p.m. and also reducing alcohol, if that's what you're doing, and ensuring that you have a sleep hygiene where you're getting at least 7 to 9 hours of sleep. Now, you don't need medication or supplements for that. So, I hope this has been useful for you. If you have any comments or wish for me to educate you about any PCOS concerns, please respond back to this. All right, that's it for today. I'll see you next time.